Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Alex in here with us this morning for his third adjustment here at Advanced Chiropractic Relief. You know, there's been a lot of naysayers, including chiropractic college professors who are teaching technique at New York Chiropractic College by the name of David Graeber, who says that he is teaching his students that what I do here is exactly what not to do on patients. And I've been doing this for 38 years. I do comprehensive histories and examinations on all my patients, like I did with Alex. And was that comprehensive in your opinion?
Absolutely, sir.
Yep. And during his history and examination and my review of his diagnostics and medical records, I discovered that he's had a 4-level instrumented fusion in his cervical spine within this year. So he is not a candidate for the ring-dinger adjustment or the manual spinal neural decompression adjustment on the y-axis because he's only less than a year out with his fusion. Now, I do adjust patients' fusions who are solid and cleared by their orthopedics, and you were referred here by your orthopedic doctor, right?
Sir.
For your scoliosis, which he has a significant scoliosis in his spine as well. Upper thoracic, mid-thoracic pain, pain around his right rib cage, left SI joint pain. And he's got some cervical stiffness. His range of motion was very limited yesterday when we did his exam. He's also got pain down into his left triceps. And did I miss anything, Alex? Okay. So, would you mind sharing with our YouTube audience who may or may not agree with what I'm doing here with the Johnson technique, but you have been here, experienced my history and my examination and my discussions with you about how you weren't a candidate for this because of your fusion being so fresh and everything. What would you tell people about your experience here at Advanced Chiropractic Relief?
This has been a great experience for me. Unfortunately, my situation is a multiple
4-level fusion.
4 levels, but it's not just that. That was a fixture, but I still have a history of scoliosis and other back issues that need to be solved. So we solved one issue with the surgery, but life goes on and we still need to fix everything
You
else.
still have biomechanical improprieties
sir.
in the rest of your spine
Yes,
as a
sir.
result of this locked up.
And-
And you couldn't move your neck to the left or
No,
right
sir.
very much at all yesterday until I adjusted you.
And with that little adjustment that we had, the pain level has decreased and definitely flexibility has increased.
Yep.
Looking forward for the
Well, and we're going to show him how we
sessions.
did that too. Now, when I'm adjusting his cervical spine on the BioPhysics table, I'm adjusting above and below his fusion levels. I'm not doing any kind of rotary, Palmer diversified rotary brake on him, nor is he getting the manual spinal decompression on the y-axis. But I'm still able to address his biomechanical improprieties of his cervical, thoracic, lumbar spine, and pelvis through the BioPhysics adjustments that I do here. And I also use the my new gun on it. What's that called? Arthrostim, yeah, which relaxes the paraspinal muscles and resets the Golgi tendon apparatus or the muscle spindles, so it helps relax those muscle tissues that are surrounding and connected to the spine. So let me just change this paper for you, Alex. So let's just show them your cervical range of motion here first. All right, so I'm gonna have you flex your head forward and backwards for me. Now see, he's really limited on his extension. Go ahead and rotate left for me. He's a lot better range of motion on that today. He could only get about half of that yesterday. Now to the right, please. So he's got limited range of motion and rotation sideways, but here's the biggest one, laterally flex. Yeah, that tightens up really good, doesn't it? And then right, that one's even worse. So you can see his head's forward and to the right on the x-axis. That's why his left hand looks longer than his right one, even though it's not. It's biomechanical from the translation of his cervical spine. Pelvis is much more centered up today. Still got that curvature in there, which I didn't expect that to go away overnight. All right, so this is Alex's third adjustment here at Advanced Chiropractic Relief. We turn down about 4 to 5 new patients every week because of contraindications for adjusting, such as people that have atherosclerosis, which is plaquing in the arteries. I don't adjust those patients because they're at a higher risk for having a stroke when that dislodges. I don't do fresh fusions on the decompression table, but we do still adjust patients like Alex because we can still help people like Alex without messing up or causing issues with his quadruple level fusion. Okay, Alex, this Leon, you tell me for me, please, sir. And these guys at New York Chiropractic College need to experience this for themselves before they go slamming it all the time. That's the second guy from New York Chiropractic College that has slammed it, and he's going to actually be speaking up at Parker this weekend in Dallas, and he sent me a message via our Advanced Chiropractic Relief Relaxes Facebook page, which I never read until this morning, and all of a sudden it popped up on me as a notification that he was going to be telling the entire student body at Parker that he's teaching his students at New York Chiropractic College that this is how not to adjust people, but he's never had it done once. Again, his name is David Gregory. He's out of New Jersey, if that tells you anything. And he practices.
He doesn't practice, he teaches.
Oh, that's right. Those who can't teach, unfortunately. Okay, slide down this way just a tad, Alex. So I'm adjusting up here at C2. Then I'm coming down here at C7. And then T1, T2 right here. Good, okay. Now let's lay there. Let me do this arthro stem on your muscle spindles. Now see, I can do this over his fusion levels because I'm only bouncing the muscle spindles here. You know, if you have a problem with my technique and my adjustments, why don't you come here and get it done yourself and find out for yourself rather than defaming my character and my techniques publicly without having any knowledge whatsoever of what they're talking about or having never experienced it for themselves. Yes, sir. Okay, let's turn you on your back now, please. So in this next adjustment, I am globally putting his cervical spine and head back posterior on the Z-axis. And you can see his big old scar here in the front of his neck. It was an anterior approach surgery. Slide down a little bit more for me, Alex. There. No, I'm not adjusting his cheekbones. I'm bringing his head up and over his spine where it's supposed to be. Slide down this way just a bit, please, sir. Okay, now put your arms straight out, palms facing up. There you go, good. Okay, you can put your hands on your tummy. Let me have this right leg. There you go. That's it, good. Okay, let's sit you. Face that wall for me, please, sir. There you go. You're still gonna be a crack at his finger. That's it. You know, when you have orthopedic surgeons and neurosurgeons and pain management docs referring to us every day to help get their patients off of opioids and other pain medications due to our procedures here, that says something about their understanding of what I do. And it's unfortunate that chiropractors in our same profession are saying bad things about this when they've never even had it done. Okay, let's stand right here in front of the mirror now, Alex. I've been practicing for 38 years, and I've done this for 38 years, and I've never even had one alleged incident where a patient reported that I hurt them. Okay, let's flex your head forward and backwards again. Now see, these range of motion's already improved there. So we're gonna pull these up and back. Hit here. Now we're gonna translate left. I know that's a hard one for you. Now look backwards as far as you can. Then I'm gonna adjust your atlas on the x-axis. Very good. Okay, now let me just do one more thing over here on your trap. That's where you feel the most tightness, right?
Yes,
It's through
sir.
here, isn't it? Through your
One-
levator scapular muscles in your left trap.
Yes, sir. And one shoulder higher than the other.
Yep. Okay, now let's have you flex your head forward and backwards again. Wow. Turn left for me, and turn right. Wow.
Less pain.
And tilt left, and tilt right. Well, that's a much improved pain-free range of motion, isn't it? And
Definitely.
see, you're more centered. You're not totally back to center yet, but you're more left than you were a second ago.
Yes, sir.
So we've got, three more adjustments to do on you before you leave. So if you have atherosclerosis in any of the arteries of your body, that means that they're probably in your carotid and vertebral arteries. And don't even bother trying to become a patient here because we won't accept you. If you have a fusion with instrumentation that's less than a year old, I will not do this procedure on you. But Alex, what would you share with our YouTube audience about the adjusting that you're receiving here?
It was definitely much needed. The functions that the neck was doing, obviously the pain migrated to
Yeah, other
the
parts of your
scoliosis,
spine.
but still you have to solve the whole
All the little
spine,
puzzles, huh?
the little puzzles, and
Yeah.
the pain is not going to go away. It's going to migrate.
Because the little
but-
pieces of that puzzle is what makes up the big picture
Yes,
when you put it all
exactly.
together.
And the longer you wait to do it, the more painful. it's
And the
gonna
more
be.
degenerated it
Yes,
is
sir.
too. So we don't want people calling you a degenerate.
No,
So
Quality of life.
that's right, it is quality of life. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Alex from Virginia. Thank you for sharing your
Thank you very
experience,
much, sir.
Alex.
Thank you.
We'll see you all soon.